Thank you, Cahilloch, and welcome, Minister. And thanks for the opportunity to speak on a matter that affects society as a whole, and certainly affects the area that I have volunteered and worked in, and that's the state of mental health supports in Ireland. A recent study by the European Commission showed that 44% of Irish citizens reported difficulties accessing mental health services, and that was the highest rate in the EU. It also found that 63% of our population have experienced emotional or psychosocial problems in the past year, and that's ranking Ireland the third highest amongst all the EU nations. But despite this, Minister, Ireland only allocates 5.1% of our health budget on mental health initiatives, and that falls way short of the WHO's their recommended 12%, and the Sláinte Care reform that recommended 10%. So we're way below that, and I think if you look at that underinvestment, it's evident even in the staffing in areas such as mental health, with 30% of the permanent consultant psychiatry posts are actually vacant at the moment, and also we've limited infrastructure regarding mental health, with only 22 acute mental health beds available per 100,000 when the EU average is 70. And I know we have to cut our cloth, etc., but it's an area that I'm passionate about. And I will say, for me, I have found that it's particularly dire for individuals who are facing dual diagnosis. And as you know, Minister, dual diagnosis is where mental health issues, they coexist with substance abuse issues. A study by the Mental Health Reform, it highlighted significant barriers for that cohort, with individuals saying that there's poor collaboration between services, lack of training of professionals, and also a lack of limited access to a continuum of care for such dual diagnosis individuals. And that means many people are being turned away from mental health services due to having a substance misuse issue, and they're being turned away from rehabs because they have a mental health issue. So therefore they're falling through the gaps without adequate support. And with my experience in setting up Tiglin nearly 20 years ago now, I have seen those impacted by addiction, and I've seen firsthand many families coming to me with their son who has been perhaps smoking cannabis for many years, and it's perhaps synthetic cannabis, and it's played havoc with his mind, and now the chap has a diagnosis of schizophrenia or something similar, and there's huge barriers in this area. And I will say rehabs such as Tiglin, Merchants Quay, Coenware, etc., they're underfunded to deal with the clinical needs that are presented. And then hospitals are often unable to help the people with their mental health because they're presenting with a substance misuse issue. And so it's in this gap that I believe people are losing hope, and families are despairing, and I've seen that firsthand. And I think we're also losing people that can be easily saved. So this gap that I'm mentioning, I think it hampers recovery, but it also leads to repeated cycles in mental health institutions, but also in the justice system as well, which could be avoided. And I know millions is spent every year with incarcerating individuals with dual diagnosis, and that's a figure that sort of underscores the need for joint up thinking. So I think from working in the sector, I think we need to treat the whole person, and that means let's stop treating the mental health issue as separate from the substance misuse, and an integrated care system to be established that their individual is treated for both at the same time under the same roof. Secondly, I do think we need to train the front line. Our doctors, our nurses, our carers, they need the tools to deal with dual diagnosis, and I know a full debate is needed in this area, as we cannot deal with dual diagnosis based on outdated training formats. Also, I've seen that 93 million has been spent outsourcing private health in the last year, and I know that's not sustainable for our economy. So I believe we need to invest in our own system, and not just buy capacity, but build it. And you've mentioned as well, we need to end the shame, the stigma that goes with mental health issues, that when somebody is asking for help, it is seen as strength. and not a weakness. So I think, Minister, my point is really to bridge the gaps in the area of dual diagnosis and let Ireland's mental health supports require an effort that all policymakers, stakeholders, healthcare providers and NGOs and society at large to prioritise integrated care, invest in the service and educate the people. And then I think we can ensure that all individuals in the cohort I've mentioned receive the support that they need. And at the end of your speech, you said it is a whole population and a whole of government issue. And I think that's really, really welcome. Thank you, Minister. Thank you, Ciaran.
Very much, Senator.